CDC's new recommendations closely resemble Denmark's, but a pediatrician and a mom I talked with today both say they believe parents should still go with the previous recommendations.
The Trump administration says the updated childhood vaccine schedule is meant to restore trust in public health, but many doctors are speaking out against the changes.
My recommendation and the American Academy of Pediatrics recommendation is to actually not change anything. The previous vaccine schedule is the one that is evidence-based.
The CDC no longer recommends vaccines for children that protect against the flu, rotavirus, hepatitis A and B, some forms of meningitis, and RSV. Instead, those vaccines are only recommended for certain high-risk groups or with shared clinical decision-making. Dr. Stephen Turkovich with Golisano Children's Hospital, formerly Oshai, addressed the difference the RSV vaccine has made.
2-3 years ago, if you came to Children's Hospital, we would be overwhelmed with patients, both in the emergency room and on the floors. And I have to say, right now, we have open beds on the floors. It's remarkable. It's great to see babies home and healthy and safe.
And he couldn't cry. He was just squeaking and miserable and so sad and sleepy.
Lauren and Grayo's twins are now 3, but when they were just 2 months old, the RSV vaccine was very new, and they didn't qualify for the vaccine, despite Lauren pushing for them to get it. Her son ended up in the PICU on a ventilator.
Yeah, that was difficult, and he would receive all of his feeds through the tube in his nose.
He was diagnosed with RSV, COVID, and pneumonia.
When we got discharged, we couldn't even go home because his twin sister had RSV too. So if she had RSV, we didn't want to give her COVID and pneumonia, so we had to stay separate for another week.
The twins recovered and are now thriving 3-year-olds.
I'm all for vaccines. I mean, I have 3 kids with autism. I don't believe vaccines cause autism in any capacity at all. So, but vaccines are very important. I'd rather have autistic kids than dead kids any day. So if even that was something, that wouldn't matter to me. But I'm definitely for RSV vaccine, for sure. It definitely saves lives.
The Trump administration says insurance companies will continue paying for the childhood vaccines that used to be on the schedule. On your side in the newsroom, Kelly Dodzik, Channel 2 News.